Dr. Thompson will examine healthcare, highlight important environmental issues, and look at what's hot in science and technology and the next wave of emerging diseases and health trends. So this and every Wednesday, join us 8 to 9 p.m. here in BFM 99.9 because your health matters.
People's Pharmacy for all your pharmaceutical, skin, and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Yes, well, we're on. Thank you very much there, Kamal. And let me express a very pleasant good evening to everyone in St. Vincent and the Grenadines. This is Gerald Thompson, Dr. Gerald Thompson with Your Health Matters. And guess what? I am in Bogota. I'm sorry, I am in La Paz. How did I make that mistake? I am in La Paz, Bolivia. That's why I mixed up Bogota. Bolivia is in South America, and it lies between Peru and Brazil. And that's where I am. I am in the capital um, of Bolivia, and it's called La Paz. Now, La Paz is actually a city that's high in the sky. It's very elevated, thousands of feet higher than La Soufrière. And that's where I am. A number of people here, when you come here, they may even have trouble breathing because the air may be a little too thin for them. You know, the amount of oxygen or so that they're having. But guess what? It's cold. It's awesome. Kamal, it's cold. I forgot to bring a coat. It's not snowing. It's nothing like that. Like last night, after some meetings that I've had here, we went on an aerial tram. They have a sky tram that takes you around the city. And boy, I had on this same jacket and I was hugging myself. I needed to have about 4 of these jackets on. During the day, it's not bad, but at night, the temperature drops and it's cold. And I was feeling cold. Now, it's interesting, though, that a couple of weeks ago, I got a call from a middle-aged person, somebody who's getting on to be a little elderly, and they were complaining of persistently feeling cold. They were feeling cold, and they wanted to know why. This is somebody who was in St. Vincent. They were hot. It was a hot day. It's a hot period of time, but they were persistently for several days feeling very cold. And they wanted to know if I understood or knew why. So it's coincidental that I am in Bogota feeling cold, but this individual was not feeling cold because the temperature outside was down. They were feeling cold probably for some other reasons. And there may be a number of reasons. I'm going to just discuss a few of those today, but guess what? There are some people who, if they don't eat, if they've been losing a lot of weight and they don't eat, or they've deliberately tried, they can't keep food down, they have anorexia, they will feel cold. Many diabetics, because diabetes tends to affect the small blood vessels coming to your fingers and your toes and your skin. There's therefore not enough blood, bringing nice warm blood, getting to your skin and your fingers, so your fingers and your toes will feel cold. In diabetics, even in St. Vincent, even in the tropics. Then there are people who may have a thyroid problem. Their thyroid is not overactive, their thyroid is underactive. They have what's called a goiter, and you could see their neck might swell, and they have a low thyroid, called hypothyroidism, low thyroid problems. And then there are other people whose nerves are just not functioning right. And again, with the fingers, it kind of makes the fingers react funny. The finger sometimes goes white, sometimes it goes purple, sometimes it goes white again, purple. They have a strange type of disease called Raynaud's disease, and they will feel cold. But I'm not talking about those things today. I'm not going to talk about diabetes. I'm not going to talk about thyroid. I'm not going to talk about Raynaud's. I might come back to it. I want to talk about some very common cause of what might make people feel cold. And usually, if you're feeling more cold and chilly than the others around you, and you're wondering why, and people are laughing at you why you're feeling cold, whether you live in North America, England, or whether you live in St. Vincent, whether you live in Rose Hall or in Park Hill, which are more elevated areas, it's possible you may be lacking some very special vitamins or even some minerals. You hear that? You'll be lacking some vitamins, you'll be lacking some minerals. So feeling cold can be due to a deficiency in certain vitamins, usually the B vitamins, certain V vitamins, not all of them, I'll come to that in a minute, and certain minerals like iron deficiency. Put your pot in the fire. There may be one of the symptoms you might have is feeling cold. And we're going to get into a little discussion on this. And just as a tip, because there may be some persons out there who are feeling this and they haven't gone to the doctor, they're wondering why, and they're just not really taking care. It's not because the outside temperature is cold. It's because certain things are taking place in their body in relation to their blood and the production of their red blood cells. And you need red blood cells to make good red blood. Let me tell you that. You need red blood cells. And to make red blood cells, there's certain ingredients. If you're going to bake a cake, you need flour, you need some sugar, you need some other ingredients, maybe some raisins, you need some other things, and you could bake a nice cake. If you don't have no flour, if you don't have no sugar, you're not baking. For your body to make red blood cells, you need certain ingredients in order to make the red blood cells. The red blood cells will travel around your body inside your blood vessels. And when they reach the lungs, they'll carry oxygen. They pick up oxygen as you breathe in. Again, so here in La Paz, right, where the air is a little thin, the oxygen is a little lower, people need good red blood cells to carry their oxygen. But I'm not talking about so much La Paz, at an elevated part of the world. I'm talking about those persons who may be in St. Vincent, who outside, temperature is not cold, outside, it's nice and hot and crispy, but they're feeling cold and they wonder why. So I want to discuss these vitamins, I want to discuss these minerals, and we'll get a little into it. The first vitamin I want to talk to you about, may not surprise you, is called vitamin B12. Vitamin B12. And do you know a number of people actually have vitamin B12 deficiency? And when this happens, it causes an anemia. It causes an anemia, a type of anemia. And where the red blood count, the amount of red bloods in your body, in your blood vessel, I can draw some blood from you and I can measure the amount of red blood cells in a certain amount of blood, in a certain drop of blood. And I will find that if you have vitamin B12 deficiency, the amount of those red blood cells is low. But not only that, the amount of red blood cells is low, these red blood cells seem to be very large, larger than normal, larger than normal. And that is because the red blood, the ingredients that you need to make nice normal size cells is not there. So your body starts to produce these big cells, but hardly any blood in them. These blood look pale, you know. So the blood cells are not red, they look pink. They look pink. And that's not good. Now, if you're lacking vitamin B12 and feeling cold, a lot of time it's likely not that feeling cold will be the only symptom you have. You will have other things with vitamin B12 deficiency. And I won't mention them. You'll experience headaches. You'll experience headaches because the amount of blood that's getting up into your head is low. It's not the right amount. When your heart pumps, and you would have headache. You will also feel short of breath. You will also feel as if you're losing appetite. You'll have some indigestion. You will also have some vision problems. And your heart will start to beat fast because your heart has to beat faster to pump this thin blood around your body faster. You're going to feel very weak and lethargic, and you'll experience all kind of funny things, even like diarrhea. And because the amount of blood that's getting up to your brain may not be sufficient, you may start having problems remembering things and understanding what people are saying. This is all part of vitamin B12 deficiency. One of the ways we also know is some people develop these ulcers, these sores in their mouth. It's a strange thing. It occurs with vitamin B12. What's the cause of it? Vitamin B12 deficiency can be caused because, guess what? Your stomach may not be working right. That may sound strange, right? But there can be antibodies. Your body could produce antibody that attacks certain special cells in your stomach that are important for absorbing the B12 in your food. You know? So that you're eating the right amount of B12 in your food, but guess what? Your stomach can't bring it into your body because those special cells in your stomach are being attacked. Another possibility is that you're just not eating foods that contain a good amount of vitamin B12. You know, people can get vitamin B12 deficiency because they're not eating the proper diet. Vitamin B12 is found in, believe it or not, animal sources such as meat, you know, and things like that. And so we tend to find vitamin B12 deficiency more in somebody who is a vegan, somebody who says they ain't eating no meat at all. Now, I know I'm going to be criticized for saying that because vegan persons feel that what they're doing is completely correct, but you may not be getting enough vitamin B12 unless you're taking it as a replacement, a tablet, because it comes from foods that you may not like to eat, like meats and so. Now, people who have had surgery, you know, some people have an ulcer in their stomach and the doctor goes and cut out their stomach. So if they don't have no stomach, then they don't have the same cells that can absorb the B12. That's how B12, from you eat food with B12 in it, from meat and so forth, it gets into your stomach. There's some special cells in your stomach that absorbs the B12, you know, absorbs the B12. And the B12 is going to go down to your bone marrow and help your bone marrow to make red blood cells. If you ain't getting B12, then pour your bone marrow. Pour bone marrow. It can't make enough red blood cells. Now, believe it or not, there are certain medications. I'll give you an example. Many diabetics are on metformin. And some people, even the metformin can cause this B12 deficiency. So people who are on metformin as a tablet for that, don't just go and stop taking it, because doc said that metformin has caused B12 deficiency. It's an unusual outcome, but if you're feeling cold, maybe from the diabetes itself, but maybe the metformin is blocking some of the B12. So, your diet is the main source of vitamin B12. And remember, dairy foods, meat, and fish are good sources of vitamin B12. And if you are vegan, make sure you take a vitamin B12 supplement. You don't have to go against your policy and your wishes of being vegan. Just make sure you take a vitamin B12 supplement orally so that you get it. Sometimes we can give you an injection. I remember when I used to practice, I used to give people injections of B12, and that they could come every month, every 2 months, and so get a B12 injection, and that boosts them up with a B12. Now, besides vitamin B12, there's another vitamin, another B vitamin that can, if it's deficient, can make you feel cold. And that vitamin is called vitamin B9. Now, you say, I've heard of vitamin B9 before. Well, vitamin B9 is called folate or folic acid, and vitamin B9 is actually a common deficiency, especially for women who are going through childbirth. Somehow during the process of childbirth, making and developing and growing the baby soaks up a lot of the folic acid, the vitamin B9 in your body. And if you're not eating enough, you could become deficient because of pregnancy. So we always worry that pregnant persons are taking extra B9, extra folic acid, so that, it's important. And folic acid is needed to make strong red blood cells, really. And without enough folate, you are also going to develop these big red blood cells, but nothing is inside them. Nothing is inside them, And I tell you, besides these red blood cells being big, the amount of red blood cells in a small drop of blood is very low. Big and abnormal, but a small, low amount. And again, folate deficiency, it just doesn't mean you're going to feel cold. You're going to also feel very weak again. You can also feel short of breath, irregular heartbeat, trouble concentrating. People with folate deficiency can start experiencing hair loss. The hair starts to drop out. When they comb their hair, you start seeing lots of hair in the comb. You start having pale skin because, remember, those big red blood cells are looking pink. So your skin is going to look a little paler. And you could also start developing sores in your mouth. So the cause of folate deficiency, I said, is mainly pregnancy. And any woman who's going through pregnancy, your doctors, your nurses are going to make sure you're probably taking some folate supplements because they don't want that to happen to you. So folate helps the little baby, the fetus, the baby growing to develop. Folate is needed for the baby. So the baby kind of sucks a lot of the folate from the mother. So the mother, if she's not taking enough folate, that she didn't have enough, she herself could become deficient during pregnancy. That's not good. Another way of getting folate deficiency is with alcohol, rum. Kamal, I don't know, rum. Vincentians, we love rum. And a lot of people drink a lot of rum, do it properly. they are usually deficient in folate too. And anybody who's had like surgery to their intestines, especially certain parts of their intestine that helps to absorb the folic acid, the vitamin B9, then, you know, they can have problems, you know, and it goes on like that. Sometimes it's genetic, it's a genetic thing. So the source of folate is not really meat. Guess what? It is more dark leafy vegetables. Dark leafy spinach, kale, lettuce, excellent sources. Dark green leafy vegetables. Peanuts having good folate. Beans, fruit, and grain, and our sunflower seed. But you will also find liver as a meat, and fish, fatty fish, they will contain. So folate and other B vitamins, you can probably take them all. You know, these days we find a lot of folate is added to bread. I don't know if folate is added to bread in St. Vincent. In places like America and England, and so it's added. It has to be added by law, but I don't know if that's the case in St. Vincent. If our bread is fortified with vitamin B, B9, but I have to check that out. I have to double check that. Now, there's another vitamin, right? There's another vitamin. I want everybody to be careful about this. You know, vitamin D. Now, let me tell you this one carefully. Vitamin D deficiency doesn't really make you cold. You thought I was going to say, no, that's vitamin B12 and folate. But if you increase your vitamin D consumption, because a lot of people are also deficient in vitamin D for a lot of reasons, they indoor too much, you're feeling cold, right, is sometimes because by taking vitamin D, it actually helps reduces the absorption of some of the other vitamins. So we often encourage people to take vitamin B at different times. Vitamin B is important. Now, I said vitamins and minerals. Clearly, the mineral I have to be talking about is iron. Iron. So I've said vitamin B12, vitamin B9, that's folate. But now we're on to minerals. And we're talking about iron deficiency. A lot of people are iron deficient. You know, now vitamin deficiencies are not the only cause of people feeling cold. And I'm bringing up now that a lack of iron in your diet, you know, is fairly common. In fact, iron deficiency anemia is the most common nutritional deficiency in the world. Let me say that again. Iron deficiency anemia is the most common nutritional deficiency in the world. And it affects about 30% of the global population. Say, come on, doc, it can't be so many people. A lot of people are not getting enough iron in their diet. And in St. Vincent, it may not be 30%, but if it's 50 or 20%, still a lot, you know? And what's happening is that what happens with iron deficiency anemia is that your body doesn't have enough iron as one of the ingredients to help make the red blood cells. Remember I said you need vitamin B12, you need vitamin B9, but another ingredient to make the red blood cells is iron. Iron. And this is one of the big ingredients. You know, you're making a cake and you put no sugar in it, you ain't got no cake. You know, iron is like the sugar in relation to your red blood cell. You know what I mean? Now, I'll tell you this, right? That the symptoms to have iron deficiency is that, yes, okay, you will feel cold. Your hands will feel cold, your feet will feel cold. But it's not just that alone. And the emphasis I'm trying to make is that feeling cold is one thing, but you got to look at the other thing. Feeling tired, again, chest pain. You hear that? A bit of shortness of breath. Being lightheaded, having paleness. In other words, we would look into your eyes and we will see these eyelids and we see they look pale. Or we look at your eyes, the white of your eyes, and we hardly see any streaks of red blood vessels, sorry. And people could be short of breath. And so what's the cause of iron deficiency? Anemia, right? What's the cause again? Well, it may be linked to the loss of blood. It sometimes means you're losing blood or some injury. Now, let me say what kind of loss of blood. Some people, especially females, they have heavy menstrual periods. A heavy menstrual period that's not only heavy, but lasts for 6, 7, 8, 9, 10 days. That's a long time. That's a lot of loss of blood, especially if it's heavy, or bleeding from your stomach. Somebody who has an ulcer, they could be bleeding from that ulcer into their stool, into their intestine. They don't even know it. Not all ulcers will cause you ulcer pains, stomach pains. There could be an ulcer there because you drink alcohol, because you drink too much spices, too much acid, or there's a germ down there, that's eating away inside, causing the ulcer, and you're bleeding into your intestine. You don't know that's going on for months and years. After bleeding for months and years continuously from your stomach, you're gonna be anemic, and you're gonna lose a lot of iron because your body's not gonna absorb it back. Another place you could lose blood and you'll be bleeding is from your bladder, your urinary bladder. There could be stones down there, or there could be a little swelling, a tumor or something that's bleeding slowly. And when you pass your water, the water's looking a little darker, but you ain't really seeing it. It's when you start seeing real things that are looking like blood, or it's really looking dark, that you may know it's bleeding, but it could be bleeding a small amount for a long time. You could lose a lot of blood, So having difficulty absorbing the iron in your stomach and your intestine is another reason. Some people have worms. Worms have kind of gone up, but some people still have worms. They have worms actually causing bleeding and things like that. Or somebody who's had surgery to the intestine, all these sort of things. And there's some genetic causes of iron deficiency. So before we stop for the break, I want to say that the sources of iron, again, red meat, but you could also get it from salmon. If you don't eat meat, red meat, and don't think I'm pushing red meat today because I said B12 but I'm talking the facts. Iron is an important thing. You get it from red meat. But if you don't eat red meat, you can get it from salmon. If you don't eat any meat at all, you don't eat fish, you get it from beans, dried fruit, eggs having iron, and dark leafy vegetables, again, kale, spinach, all them sort of things. In some countries, bread, cereal are fortified also with iron. And I would love to see the day when farine is made and they put some vitamin inside there and some iron. That'd be good, It could be sold and so forth. Now, if you are taking vitamin C because you heard it also enhances iron absorption, keep in mind that vitamin C deficiency is not so common. In St. Vincent, we got cherries, we got so much fruit, but taking vitamin C with iron supplements is likely to have minimal or no clinical impact in treating the iron deficiency anemia. You know what I mean? So you just got to really take the iron, So Come on, let's take a break here. I'll come back and we'll get a little bit more into this sort of thing.
People's Pharmacy for all your pharmaceutical, skin, and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Okay, we're back. So what I've been doing, I've been responding to someone who called me and said, I've been feeling cold. I haven't examined that person to find out what is the real reason, but I was able to tell them that based on their symptoms of persistently feeling cold in a hot country, it may mean that they have a B12 deficiency, a folate B9 deficiency, or an iron deficiency, or a combination of these, and they should watch it. Now, I want to touch on some other conditions that can make you feel cold. That's not vitamin and minerals, at least most of them. I mentioned them in the beginning. Persons who just not eating at all. Persons who don't want to eat. They're psychologically, they want to remain thin, or they think that they are looking good, or they think that they're fat when really they're thin. These people are anorexic. And because they are not taking food into their mouth, they then don't have the ingredients to make red blood cells. You understand? They're not eating. So they're not eating protein, they're not eating B12, they're not eating folate, not eating iron. That's a problem. I mentioned earlier about diabetes. Now, diabetes is characterized by having high blood sugar levels. But you know what happens? When your blood sugar levels has been running high, and has been making your blood syrupy and slowing your blood down, those very tiny blood vessels in your fingers and your toes and so forth, my boy, they start getting blocked up. Blood isn't flowing through them as nice as they should. And you are going to feel cold because blood brings with it heat, the nice body heat. So if no blood is reaching your fingers and your toes, they're going to feel cold. If your blood vessels are just too narrow, the blood can't reach them. So diabetes tends to attack and affect the very, very tiny, tiny, tiny blood vessels all over your body, in your toes, your feet, your fingers, your skin, and you feel cold, among other things. And then I mentioned about the thyroid. Now, hear what? A lot of thyroid conditions is actually low thyroid. It could be due to not having enough iodine in your diet. Now, I'm not going to advocate to people to start consuming a whole set of iodine. You have to get the blood test first to find out if you have a problem with your thyroid. When possible to problem with the thyroid, I'm not talking about overactive thyroid. I'm talking about an underactive thyroid, a low thyroid. They will have situations whereby they feel slothful, sluggish, they sleep all the time. Their heartbeat starts to slow down, and they basically start feeling cold. And so the thyroid, much of it is caused by iodine deficiency, which is another mineral. We get those kind of minerals from fish, from seafood. Luckily, salt has iodine in it. It's called iodized salt, and that's enough in most countries to really supplement you. So I've gone through the important thing, but to find out, you really have to get tested. you have to really go to a doctor and get tested, and they may find a lot of things that may be wrong. But the important thing is that you check it out early. A stitch in time will save nine. If you feel cold just for one day, that's no problem. If you've been feeling cold for weeks and you're wondering maybe something going on, it may be one of these deficiencies that I'm talking about: B9, folate, B12, or iron, or it's a deficiency in your diet, in protein, and you just aren't eating the right ingredients in order to make food. So I am in La Paz. I have to also go out after the show. I don't have a coat, but you know what? My blood is good. I've got good blood. I've got good red blood. I've got lots of it, and they're nice size. And they're not big, massive cells. They're not small ones. It's not Goldilocks where they're too big or they're too small. They're the right size. But I thank God for that, and
I just
that's
want to
going to
ask a
help
question,
me.
Doc.
Yes.
As you mentioned, you're high up, so the oxygen it's thin. How are
Yes.
you how are you coping?
Well, I tell you something. You know, I'm not going to reveal my age on radio. Kamal, you're not going to get me to reveal my age on radio. I'm a young Gerald Thompson. Is that? And I'll tell you that last night when I was in this aerial tram, I must have been over 4,000 or 5,000 feet above. Maybe I don't show. And at times, I was feeling a little chesty. I was feeling a little short of breath. But I started taking some deep breaths, and it was okay. Some people who came in, what the high altitude caused is for their blood pressure to start to go up. And several persons had to even get medication to keep their pressure down because their heart, sensing that their red blood cells are not getting enough oxygen, started to pump harder to get that blood around the body. You understand? And by pumping harder, it raised the blood pressure. And so they had to calm things down a little bit, get the person to rest. And these places may be ideal for athletes doing training, or for people who are very fit and so. But, they have these massive villages on the hillside of La Paz. And all you're seeing from the aerial tram is steps going up. I'm talking about almost a mile of steps going up these hills. I'm not sure if I might be able to climb that thing, but recently I did do a La Soufrière. And about several months ago, I did climb up La Soufrière, and it was fine. I did it well, and I had no impact at all. So, Kamal, if you are trying to imply that a person like me should be having some effect, I want to tell you you're damn wrong. Yes, sir.
Well,
You're
you
right.
mentioned it, so I thought maybe, just maybe, it might have had an effect on you, or you would have felt it.
No, I observed that it had effects on other persons, and those effects, being at that high altitude, in Colombia, Bogota, that's a high altitude too. In Denver, Colorado, that's a high altitude. There's certain parts of the world that are very high, and people go there for training, and individuals who live there, or new people who come there, if they're not aware of it, they can run into trouble because the oxygen is thin and they are not then getting enough oxygen coming into their body, especially if they have an underlying illness such as B12 deficiency, folate deficiency, iron deficiency, on top of not getting enough oxygen, then that's not good. That's not a very good situation to be in, you know? Kamal, I don't know if we have any other texts, any other callers or so. We're at 8
all right.
41.
I see a question I don't know if it's a question, but it says, "Good night, Doc. I am on board listening to your program. I am from Grenada. I would like to have a contact from you if it is possible. Blessings." All right. There's just someone from Grenada wanting your contact.
Okay. All right. That's nice. Yes, I'm sure they'll be able to get my contact. Well, everybody knows my contact, 784-528-6600. It's strange, when I used to be a politician, I used to get my number. Now I'm more a private citizen. One would expect I would hold back on that. And so, but if somebody really wants to get, I don't know what the reason is. Maybe there may be some medical reason, or maybe to give some advice. So I have no problem with sharing my number, I hope that person make up. Now, the person should know that I can be reached by WhatsApp, but they can't call me straight because I am in South America, in Bogota. What I want to say, Kamal, is that I mentioned that iron deficiency is the most common nutrient deficiency in the world globally. And I must tell you again, a lot of people around the world have little worms, little parasites that's inside their intestine, that's eating their joy, eating their nutrients, and preventing the absorption of important nutrients like iron and so forth. Hookworm and so forth. Everybody, we don't have a lot of that in St. Vincent today. We used to have it, you know what I mean? We don't have it, but in some parts of the world, those things are still rampant. There are people who have a different kind of germ in their stomach. One that's called HP, Helicobacter pylori. It's a germ that lives inside your stomach, and you catch it from kissing somebody or from eating contaminated food or drinking contaminated water that has been contaminated, and the germ loves it there. It can withstand the acid inside your stomach. It can withstand the acid. This germ is unbelievable. Whereas acid would kill most germs. You eat most food, and the acid in your stomach would kill the germs on top of the food that you eat. But this germ, it can't kill it. The acid can't kill it. It's resistant to the acid. And it knows how to cause ulcers. And it causes ulcers. And by causing an ulcer, there could be a slow bleed from your stomach. It ain't causing no pain. It ain't causing no cancer yet. It's just causing bleeding over 2-3 years. And you go somewhere and find that, bang, it is, you're anemic. Why are you anemic? Because you've been bleeding from your stomach. But clearly, why iron deficiency is the most common deficiency in the world is because women and their periods, heavy periods, if they've been so many things that could cause women to have heavy periods, if they have a fibroid in their ovary, if they have all sorts of different problems, but they bleed in longer, sometimes for 10 days, sometimes women can bleed for longer, and that's happening every month. It's horrible. Oh gosh, I sympathize with you women in those kind of situations,
Somebody writes here, the mineral magnesium is probably second in deficiency.
That person is very astute, and that person is very right. Magnesium is something we don't hear about. You know what I mean? Come on. Magnesium is something that's really overlooked. I have to come back and talk about the magnesium because I know time is short, but it's overlooked. But boy, magnesium is such an issue that yes, a lot of people have the deficiency of magnesium, and it's silent, it's slow, and right now we're focusing on the iron deficiency, which I think is very big. And I have to come back at some point in time and talk about those other deficiencies. Now, I haven't gone into a lot of detail in relation to a host of other deficiencies that somebody has. I started off really by talking about persistently feeling cold in a tropical setting, and you gotta try put on an extra blanket in St. Vincent. Come out, not having a sheet, having a blanket. Come out, you sleep on the blanket? Huh?
Say that
Come
again.
out? Huh?
Say that again. I didn't.
I was asking if you sleep under a blanket.
Oh no.
Most people who sleep on the blanket will start to sweat. And so, but feeling cold, and we've had a few cold spells passing through St. Vincent, right? But this is not a cold spell. This is just persistently feeling cold because of these deficiencies that come from the diet. And you really need to get all those ingredients and make sure you have. And today we're able to test for iron, especially for iron deficiency. Some places we're able to test for B12, and these things can definitely be replaced. But if you're not even going to get tested and you go with regular supplement, I'm not going to fault you for that. It's good to know. It's good to get tested, especially with iron deficiency, right? And it gives us a much better idea of when the end point is. Because when you start to take iron, one of the one of the side effects of taking iron on a regular basis is that it makes you constipated. Yes, sir? It makes you constipated. It can make your stool look a little dark as well, but it makes you constipated and not being able to move your bowels, because you're constipated is it can be very distressing to some people, right? So that is as we treat things, we don't want to cause another problem. We don't want to cause a second problem. So all those persons who are listening, I want you to pay attention to what I've been talking about. Feeling cold is not the only symptom of these deficiencies. There are other symptoms, but I've pinpointed feeling cold as one. I must also say that you can have the other symptoms without feeling cold. So feeling cold doesn't come on its own all the time. If you have iron deficiency, you can feel tired, weak, lethargic without feeling cold. But I was just bringing out the feeling cold kind of gives an alarm to you and also to the doctor that there could be some sort of deficiency in your diet that can be easily replaced. But getting the testing done first would be most helpful for the doctor. And we could then measure and know how much replacement, how quickly to replace it, and how long to replace it, how to give you the supplements for, and so. And if it's iron deficiency, then what the doctor is going to do, he's going to look at the blood cells. Is it iron deficient because you're not eating the right type of food? Or is it iron deficient because you're bleeding from your menses, you're bleeding from your urine, you're bleeding from your stomach? So the doctor is going to maybe do a stool test to see if there's blood in your stool. He's going to get some urine sample, check to see if any blood is in the urine. And you, female, will be able to tell the doctor or her how many days you're seeing the period for, how heavy it is, how many pads you use, all those sort of things. And in those ways, we'll be able to tell if it's too heavy, twice as heavy, all them sort of things. Those are the questions that we will need to answer. And those are the questions that will really help bring things to the fore. Kamal, I tell you, I have been working hard, at these meetings, long days, and I can tell you that Bogota, in spite of it being a little cold, is still very nice, still wonderful. I'm amazed at, I keep saying Bogota. Let me correct, La Paz. Why am I saying Bogota? Why am I saying Bogota? I want to apologize.
Did anything fun as yet?
If what?
Have you had a chance to do anything fun as yet?
On these missions, I don't do anything fun. Although, I'll tell you something. I went out and I got some fruit. I'm going to be eating this in the morning. This is called a cherry moya. I'm going to put it up close. It's a cherry moya. It almost looks like a sugar apple. It looks like a sugar apple. It's related to the sugar apple, related to the soursop. And it's a cherry moya. If you think sugar apple nice, cherry moya is the nicest thing out. I have fallen in love with cherry moya. And I'm going to, oh my God. I shouldn't do this on the radio. And also in the morning, I am going to have my horn melon. You see it? Come on.
Yes.
Horn melon. It's really nice. And another thing that, prickle pear? Prickle pear? The cactus.
Yes. I think we have a different.
Puts out these things. I have tasted them, and La Paz has them tasting absolutely great. This prickle pear, one of the great ingredients inside this, it's red interior. It has iron inside it. So I want to make sure I keep my iron supplements up. I can get it from fruits. I don't have to take iron tablets. I don't want to get constipated. You know what I mean? And I'm gonna get my iron from fruits and other things like that. And that's why I really showed you. I didn't want to make people jealous that I'm gonna eat cherry moya and horn melon and those other things. That isn't the reason why I showed you. I'm showing you that maybe I want people to get a little jealous. You know what I mean? Maybe.
Somebody said that I think they're referring to the one. Well, one of them. I think maybe the oh gosh, you want with the pickles on it. They said this looks like the noni. I think it's some family.
It's not. Oh yes, it does look a little bit like the noni, but it's not related to the noni.
Oh, okay.
This one, if it's this one, it's a melon for sure, and this one is a. Oh, you know what? The noni is called Jumbi soursop.
Jumbi soursop, yes.
But it's not related to the soursop. It's a completely different thing. This one is related to the soursop, but it's no Jumbi soursop. It's one of the sweetest, and it has a lot of high fiber in it. And it's going to, you asked me about adventure. I'm going to have some adventure with it in the morning. Is that? I'm sorry, come on. I have some adventure with it in the morning.
Well, you enjoy it, man.
Well, that's the way I enjoy. I'm not gonna go out. I'm not here to party. I'm for serious business. I'm here for serious business. You know what I mean?
So I guess you would not have the time to at least experience the culture.
Yes. I tell you something. Lots of that with drummers. The indigenous people. It's amazing, some of the things. and I've done quite a bit of that, and so, but it's not the focus of attention, and so, but the Bolivian people, the traditional people, it's amazing how they dress. I bought a shirt this morning. Let me show you. This is a traditional dress.
You should have bought a winter coat.
Now, you know, there's a point about buying a winter coat. Then I got to lug it back, and so, and I'm gonna slug it out. You know,
Yeah, I'm just
I'm gonna
kidding.
slug it out. Yes, well, you know, we finishing early a little today. You know,
Oh yes, I appreciate.
I've got to rush off. So I want to just remind everybody that these deficiencies are quite common, and I want you to pay some attention to them. When you go to the doctor, you know, your annual checkup, or if you're feeling ill, don't hesitate. A stitch in time can save 9. And remember, feeling cold, B12, folate, iron, and a number of other things. I want to bid you a very pleasant good evening and good night.
People's Pharmacy, for all your pharmaceutical, skin and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m., Monday to Saturday.